Hello there, welcome to Pets Aplenty. Today on the channel, we will look at a disease that affects some animals and even humans. Thankfully, it is preventable and also largely curable, as only a rare variation could prove fatal in animals. Be sure to watch this video to the end so you can be well informed about its symptoms, mode of transmission, prevention, as well as cure. Also, you will discover its areas of higher concentration in the United States. Do well to give the video a thumbs up, subscribe to the channel, and turn on post notifications. Let's dive in. Lyme disease, known scientifically as Lyme borreliosis, is a zoonotic disease that affects both humans and animals. According to the Center for Disease Control and Prevention, it is the most reported vector-borne disease. The vector that transmits it is called ticks. It can be hard to detect and can lead to severe recurring health problems. The possible best form of action against this disease is to prevent it by taking the necessary measures to avoid tick bites. Vaccination as a form of prevention is also a viable option in dogs. This disease is caused by a spiral-shaped bacterium that looks like a worm called Borrelia burgdorferi. This bacterium is mainly carried and transmitted by the deer tick, a tiny black-legged tick that dwells in forests. They can also be found in areas close to bodies of water that are grassy, wooded, or marshy, like rivers, lakes, or oceans. That is why deer ticks are likely to bite people who go outdoors on hikes, camping trips, and such related activities. The name of the disease comes from Lyme in Connecticut, where several incidences were discovered in 1975. The disease has long spread all over the United States and the world, found in humans and several animals. The CDC keeps a detailed map of areas where Lyme disease has been confirmed. In the U.S., certain areas are known to be specific places where the disease appears. These areas are the eastern Mid-Atlantic states, the southern New England states, and the upper Midwest, specifically Wisconsin, Minnesota, the West Coast, and Northern Carolina. This disease is also a reportable one. Healthcare providers and laboratories that detect the disease through confirmed laboratory tests are required by the government to record and report such cases to their local or state departments. They will then pass the information on to the CDC. The best form of control for prevention is to keep your pet safe by taking preventative steps to reduce the possibility of getting Lyme disease. Pet owners should carry out all year-round prevention. This is even more necessary during the final weeks of summer, as pets and humans are at risk of contracting Lyme disease. Other diseases such as Rocky Mountain fever and anaplasmosis carried by ticks are also a possibility. Preventative steps include using trusted products that are known to prevent the occurrence of ticks. Your vet's advice should be sought for the most suitable products for your pet. Also, consult your veterinarian to ascertain if your dog should be vaccinated against Lyme disease. Factors that include such decisions include your location, pet's way of life and health, and other conditions. As much as possible, avoid areas with tall grasses, marshes, and woods that are possible tick-infested areas. When indoors, do well to check for ticks on yourself and your pet. Clear shrubs around your homes and ensure your lawns are well maintained. As we have earlier said, vaccination that serves as Lyme disease prevention is an option for dogs. Nevertheless, it is to be noted that it might not be for all dogs. This is why you must consult with your vet to decide what is the best action to take for your pet's well-being. Suppose your vet advises a vaccination for your pet. In that case, the usual procedure is the first vaccination followed by a booster shot in about 2 to 4 weeks. Then, subsequently, once a year, boosters are given. Again, do well to consult with your vet for all these fine details. Also, note that infection with Lyme disease in pets may not show any sign for 2 to 5 months. When the symptoms appear, they come in the form of fevers. The pet is likely to lose its appetite. It will also experience lameness and swelling of the joints. Of course, this will lead to a decline in the physical activity of your pet. The lameness can be recurrent, with the part affected being tender. The swollen joints could stay for days and weeks, moving to different extremities. The symptoms in horses include pains in the joints, neurologic disease, problems in the eyes, and the skin. The symptoms of Lyme disease and those of anaplasmosis are so identical that it is hard to tell which disease signs are shown. Both diseases are also found essentially within the exact locations. The best way to know if your pet has been exposed to the bacteria is through a blood test. Self-medication is discouraged in treating Lyme disease. Instead, it can be treated with antibiotics. Follow your vet's advice on treatment and subsequent medical requirements. Ticks are the primary vectors of Lyme disease, hence the condition is not transmitted directly from animal to animal. The transmission is essential via tick bites. Although this is the case if you have multiple pets, your vet is likely to suggest a test of all your pets if one is discovered to have Lyme disease. This ensures that fast action is taken just in case the others get exposed to ticks. Also, pets and humans interact freely, indoors and outdoors. Suppose any human or animal is found to have Lyme disease. Everyone in the family who may have been exposed to such tick environments should be tested to ascertain their status. Let's see how Lyme disease works in horses. Although curable, the disease can be somewhat of a mystery and confusing in equine because the indications can be unclear. A small lump on the body, general weakness, and sore joints can indicate the presence of Lyme, but still, that can also point to other diseases. This generic nature of the symptoms often poses the difficulty of deciding if they indicate the presence of Lyme disease. Nevertheless, if your location is home to ticks, it may be Lyme disease. That said, remember that prevention is always the best option, especially in equines. As indicated earlier, horses can contact this disease from a tick bite, the most common one being the deer tick. According to researchers, to be able to transmit the disease to the horse, the tick would have to stay on the first for at least 24 hours, according to researchers. And yes, again, horses can't transmit Lyme disease directly to other horses. It has to be through a tick bite. According to research, horses could be infected and yet do not develop any signs or symptoms. They could be infected and develop immunity such that no symptoms may appear. Also, not all ticks have bacteria, so a tick bite does not automatically translate to having the disease. Research indicates that it is 30% of ticks in high-risk areas that carry the bacteria. Doctors are not sure why some horses build immunity and others don't, so it's advisable not to take chances with your equine friend. Again, as a reminder, the signs in horses can also point to other sicknesses. Still, symptoms that have been seen in infected horses include that the place where the tick bites will be swollen. Other places that will most likely be swollen are the joints. There will be swollen eyes, lameness, stiffness, general weakness, and overall behavioral changes. Another severe impact could be on the horse's central nervous system, leading to fever, neurologic indications, wasting of the muscles, eating difficulties, and sensitive skin. This form of Lyme disease is called neuroborreliosis and is usually fatal. In the midst of all this, only a vet can genuinely ascertain the presence of Lyme disease. They usually do this through detailed diagnoses, physical examination, and checking for lameness in blood tests. If there are signs of Lyme, it is safe to exclude other possible causes until the absence of Lyme is confirmed. Amazingly, when Lyme is discovered, it can be treated if it isn't the same type that affects the central nervous system. A typical treatment of antibiotics will take 4 to 8 weeks in horses. A one-time treatment is effective, though a slim chance of it recurring is a possibility, such as very rare. So there are often no long-term effects on the horse. Possible problems that may arise from treatment are resistance to antibiotics if they are overused. Suppose the symptoms in the horse continue after treatment. This could be a sign that there are other problems. Also, using tick repellent sprays on the horse is very useful. Since it takes 24 hours for ticks on horses to transfer the bacteria, grooming your horse becomes a great way of preventing Lyme. If you observe and can remove ticks in less than 24 hours of their presence, then your horse has a chance of being safe. A daily thorough groom routine will be pretty helpful. Fortunately for people who own horses, the most common form of Lyme disease can be treated. Lyme also affects dogs, mainly exhibiting the same general swelling symptoms and associated fevers and lameness. One unique effect on dogs that could prove fatal is the effect on the kidneys. So, keeping your canine away from contacting ticks is the best preventative measure. And of course, since dogs have a vaccine, that is a specific form of prevention. Although summer months have a high potential for ticks, the danger pressure is present throughout the year. Take note of this to ensure you protect your dog from ticks year-round. Ticks are potential problems to cattle, also leading to low milk production and abortion. They also affect humans, with bites that the effects surface even years later. By and large, avoid ticks like the plague, and do all within your ability to stay healthy. We truly hope you found helpful information in this video. If you did, click on the like button and share. Remember, subscribe to our channel and turn on post notifications so you can be the first to know when we post a new pet video. Thank you for watching.